The American Urological Association has set forth the Genitourinary Syndrome of Menopause guidelines. Tell my followers what a breakthrough this is. Like how important this is.
This is enormous. This is enormous. Guidelines. These are guidelines that are from the Urology Association and the Urogynecology Associations and the Menopause Society and the Women's Sexual Health Society all got together and they agreed upon guidelines to say how we should be diagnosing, managing, and treating the genitourinary syndrome of menopause, and how it's not just a menopause, it's perimenopause, it's breastfeeding, it's birth control pills, it's so many other symptoms that happen when you change hormones to the genital and urinary tract.
I am so excited to share this news. I'm bringing you a major update in women's health that every midlife woman needs to hear. The American Urological Association just released new guidelines on Genitourinary Syndrome of Menopause, called GSM for short, and they're long overdue. Now, let's be honest, how many of us know what GSM is? I didn't know. I just found out about it like a year and a half ago. And I work in healthcare. I read papers all the time. So, I think this information guidelines will help so many women, because it's just not that women are not aware of the treatment. They are not even aware that it's considered a problem. It's considered a disease. Because when these things happen, you just chalk it up to, oh, I am this many years old, I have that many kids, I've heard my, mom, grandma, aunt talking about it, so this happens, and you just accept it and you just deal with it, which is not the case. Now let's talk about what GSM is. GSM is a medical term that covers a bunch of symptoms related to drop in estrogen levels during perimenopause and menopause. And these symptoms are extensive, and some people have more than one, some people have all of them. So it includes vaginal dryness, irritation, burning, pain during intimacy, recurrent urinary tract infections, urinary urgency, frequency, and incontinence. So it's not just down there discomfort. GSM affects your quality of life and even your emotional well-being. So why does GSM happen? As estrogen declines, so does the health of vaginal walls and urinary tissues. They get thinner and drier and more fragile. And that means more irritation, more infection, and more discomfort. And unlike hot flashes, GSM doesn't fade with time. So if you don't treat it, it usually gets worse. So what does the AUA recommend? Here's where things get exciting. The AUA now recommends a stepwise personalized approach to treating GSM. Number one is education. Women needs to know GSM exists, and that's common and treatable. So that's number one, because I think women doesn't even know that these things are considered a disease, a problem, right? It's so once they have the information, now we can focus on the treatment. So number two in the recommendation is a lifestyle, and that includes staying active, pelvic floor exercises, avoiding irritants like harsh soaps or wipes. Number three is over-the-counter options like vaginal moisturizer and lubricants for mild symptoms. And number four, that's the exciting part. So for moderate to severe cases, vaginal estrogen, DHEA, or oral medications like ospemifene, I hope I'm pronouncing it correctly, are recommended. But I can already sense it. Like a lot of women will be saying, I'm scared of hormones. But let's just talk science. Low dose vaginal estrogen doesn't flood your body with hormones. It works locally, right where you need it. And it doesn't significantly increase your systemic estrogen levels. And here's the jaw dropper stat. Studies show that women who use vaginal estrogen have up to 70% lower risk of mortality compared to those who don't. Yes, 70%. I did not know that UTIs and incontinence and all these things combined was also killing people. And 70% lower risk. And this is for everybody. It's for people who just stepping into perimenopause all the way to your 98-year-old grandma who is in nursing home. So not only are we talking about quality of life, we are also talking about quantity of life. And all major medical bodies agrees. This is rare. It doesn't happen this often. So AUA, NAMS, ACOG, they all are in support of using vaginal estrogen, and they have deemed them as safe and effective for long-term use. So the final takeaway should be, if you are experiencing any of the symptoms, and if you are 35 or over, I'm pretty sure you are. So please don't just brush it off. Take it to your provider, and if they dismiss you, find the one who won't, because you deserve, in this day and age, you deserve a provider who understands the new science and it treats you like a whole human you are. I will link trusted resources below to help you get started, including how to find a menopause informed clinician. And if you want more science-backed info on thriving through midlife, please hit the subscribe button, and I'll see you next time.